Medicare Advantage differs from Medicare in that it is primarily treated as a traditional insurance company like your Blue Cross, United Healthcare, where Medicare truly is a federally funded program through the government.
It's supposed to be just like a traditional Medicare plan. However, we're finding that that doesn't really seem to be the case. Even though they're supposed to follow the same rules and regulations, we find additional barriers to care that are put in place, and patients are finding surprises that they didn't expect.
They may offer lower out-of-pocket costs for premiums. Much of the time, the cost sharing is different. The pre-authorization requirements are much more stringent and they're higher. They will deny care that would be approved under traditional Medicare guidelines.
The financial side of it may look beneficial, but the services that are covered or authed or allowed are much different. And they're usually taken aback or caught off guard from that because they do not have an understanding of what the significant differences are. And so then when they have an ER visit and then they get admitted to the hospital and they realize this isn't covered and now I have to pay for all of it, or it's only covered as an outpatient or an observation versus an inpatient stay, it can be somewhat a defining moment for them because they don't have the resources at home to take care of them, and they don't qualify to be in the hospital or a nursing home. And so then their family is like, what do we do with this? And it causes some pretty significant distress.
Another struggle we see with Medicare Advantage is delays in necessary care. So it's very frustrating for our physicians and their patients when they order a test or procedure and they have to wait up to 15 days to receive determination on whether or not they can have that service, whether it's an MRI, a CT scan, approvals for physical therapy. It's all a big challenge to try to get the care they need in a timely manner.
Medicare Advantage truly is having a huge impact in our community and hospital merely because of the campaigns that they show. They're really pushing Medicare patients to sign up for Medicare Advantage, saying it's lower cost. The benefits are just the same as Medicare. Well, the impact to the hospital is truly providing a financial burden for us.
More and more over time, I think we're going to see, certainly it's occurring nationally and now it's starting to be seen regionally, is that many providers and facilities are no longer accepting Medicare Advantage plans. People in our community that do have a Medicare Advantage plan are going to have limited choices in terms of specialty services and providers that they can see in the future.
My advice would be to research both options, make sure you understand them, and research from independent sources. The United States Office of Inspector General has a detailed report on Medicare Advantage and some of the issues with it, but my personal advice would be seek traditional Medicare. You'll be able to be seen wherever you want to be seen with traditional Medicare.
I love rural healthcare because the impact we get to make on people's lives is far larger than any tertiary facility will ever be. When the same doctors that you see in the clinic, in the emergency room, in the hospital, are the same ones that are at the baseball games and the football games and the grocery store and at church, the accountability to make an impact is so incredible, and the opportunity to change lives is much higher.
Healthcare is one of the key cogs in a rural local economy. It's very important to support agriculture, small businesses, and helps to recruit and retain people of all ages in our community.
I think that the lives in rural America is just as important as the lives in urban America, and we need to make sure that they have good access to high quality healthcare.
I'm Lori Masnick, and I believe that strong rural health makes a strong rural Nebraska.